Okay, so our lesson number two is towards understanding falls. So we need to understand falls in depth so that we can prevent them from happening because they are very, very, very much prevalent among older adults. There are certain interventions to reduce the risk for safety problems. For example, by reducing hydration and nutrition risks. So by having adequate hydration and adequate nutrition. And so by also addressing the risks associated with sensory deficits, vision, hearing, and taste and smell. So there is, if the older adult is having a problem with vision, for example, we need to fix the vision problem so that they can see and it can prevent them from fall. Also, we need to keep monitoring temperature and blood pressure because whenever these are high, they can affect the cognitive function of an older adult. Also, by preventing infections, such as by following precautions such as hand washing. Sensible clothing is very important because, and we mean by sensible that are adequate and that they are um, as they prefer and they are suitable for the environment and the temperature for each for the summer or winter or for each season of the year. Also trying to avoid crime by, for example, instructing older adults to not move at night, for example, or having their valuables being locked in their houses. Also promote safe driving and also early detection of problems such as cognitive dysfunction or any, for example, problems related to abuse. Major safety problem or the must major safety problem or the biggest safety problem that face older adults is falls. So what is fall? A fall is defined as an unintentional loss of balance that leads to failure of postural stability. A fall could be a sudden and could be unexpected change in position, and it's usually resulting in landing on the floor for older adults. Recurrent fallers are those that have fallen 2 or more times in either 6 or 12 months, according to the criteria by Studinsky in 1994 and Gregg in 2000. We are more concerned about an in-hospital fall. So what is a fall or what is an in-hospital fall? So when you find a patient on the floor or lowering or assisting a person to the floor is considered a fall and needs to be documented as such. There are many myths about falling. So one of the myths is that it's due to carelessness from an older adult. Also that it's a normal process of aging, which is the biggest myth that you can hear, and they just happen, so we cannot prevent them. And also another myth is that it cannot be predicted or anticipated or prevented. So all of these are very important myths we need to understand, so in order to raise the awareness of nurses in the few facts about falling. There is 1/3 of community dwelling older adults fall annually, which is 50 to 100% happens in nursing homes. We do not have nursing homes here, but we do have a lot of incidents of falls in our hospitals. 95% of hip fractures are caused by falls. Then also 25% falls lead to injuries that reduce mobility and independence. And not only that, but 50% of patients who get injured from a fall can no longer live independently, which is a very, very, very frightening fact. Let's talk about facts about hip fractures. There's 1 in 7 women will, will break a hip in the future. 25% will regain full functional ability, but 50% will end up in nursing homes or they will end up in the hospital. Okay, which means that they cannot live independently. 25% will die within 1 year because it's a huge, it carries a huge risk of immobility. The risk of dying from osteoporosis is equal to the risk of dying from breast cancer. So they are equally important issues. So it's very much equal to dying from breast. So why do people fall? Well, 31% because of accidents related to environmental hazards, and then also 17% because of the gait and balance problems, only 10% because of dizziness or vertigo, and 4% because of confusion in older adults. And we have talked about this in our previous lectures, that in older adults, whenever they have a change in their homeostasis or in pain perception, they start to manifest it as being confused. Postural hypotension in 3% of people, and vision can be in 3% of people, and then also 20% are unknown. They do fall because of unknown reasons. So where do people normally fall? So for those 65 and above, 60% happens at home. Another 30% occurs in public places and 10% only in healthcare institutions. However, we need to protect them when they are in healthcare institutions or in